Okay, so guess what? This is the last recording you will ever see for BMS 175. So the last part was part 4. I think I called it part 3. So sorry about that. So this is the last part of the aging topic. We're nearly at the end. I cannot believe it. So let's get cracking on the nervous system. I've left the big ones for last. Okay, what happens as we get older? Why isn't this doing anything? Here we go. So as we get older, we lose neurons. So neurons die. And not only do we lose neurons, we also lose the cells that sit around the neurons, which remember, they were glial cells. So we also lose neurons, but the neurons that we have left also don't make as many or as much neurotransmitter as they used to. That means that you have less nervous tissue. Your ventricles actually increase. I'll show you a picture of that in a minute. Now, the axons or the neurons that are sitting outside of the central nervous system, so outside of the brain and spinal cord, so they are called the peripheral nervous system, they actually think that they kind of die back a little bit, which means that the axons in the peripheral, so going down your arms and your legs, they get shorter because they're dying at the ends, okay? And there's also evidence that they lose their mitochondria and they sometimes lose some of their myelin sheath. So that integrity of that nerve is going to be compromised. The other thing that's compromised is the blood-brain barrier. So remember how we saw in our kidneys that the filtration membrane was getting a bit sloppy, a bit shabby, and letting things through that it shouldn't have let through? Well, the same thing goes for the blood-brain barrier. It is not as tightly controlled anymore. Blood flow decreases to the brain. Yeah. And the other thing that happens is that the autonomic nervous system, the way that it functions, it doesn't function as well as it used to function. Okay? So what we're going to do is we're going to look at some images now to kind of reinforce these messages that I've just presented. Okay, so here we go. Here's your brain. Here's a coronal section, so like this, we cut it like that. Here are our neurons, and look, as you can see, as we get older, we lose them. They die and they get damaged. Yeah. So this is actually going to make our brain tissue significantly less. So see this hole here, there's fluid in there. That means that we're going to have bigger areas like this. So there's just going to be more spaces where there used to be brain, but there is no brain in there now. Okay. This is the blood-brain barrier. Let's have a look at it. So this is what it looks like when it's fully functional. So as you get older, the basement membrane gets a little bit thicker. Okay. We lose the connections between endothelial cells. So if there's two cells sitting side by side here, so you normally have one cell and another cell, and then they're connected really like a stapler or like super glue. So nothing goes between them. But as you can see here, we start to lose those connections. It's getting you can actually sneak through there, which makes it more likely for things to move from the blood and into the brain that shouldn't. There's a couple of other bits and pieces. So as you can see, your proteins don't work as well. Yeah, and then you've got less mitochondria. I don't know what ROS is, but yeah. So essentially, I think for you guys, just focus on the fact that the integrity of the blood-brain barrier is not as good as it once was. So it's not as tightly controlled as it used to be. It's kind of falling apart a little bit. Right. Let's have a look and see. So remember that when I said that the autonomic nervous system doesn't work as well as it used to? Yeah. So that is all of your involuntary things. So this is, remember this one just dealt with, this one, somatic nervous system just dealt with the skeletal muscle. So this one deals with smooth muscle, cardiac muscle and glands. So that branch of it, that motor output branch, is not going to work as well. Okay, so just be mindful of that with an elderly person. They may be able to control their skeletal muscles a lot better, but their cardiac muscles, smooth muscles and glands may be a little bit dysfunctional at times. And then this is what they think is happening to the neurons in the periphery, so your peripheral nervous system. So they think that this is a neuron, this is the way it should be, but I think they just say that they die back, so they shrink, they've got to die back, and eventually we lose that kind of neuron just from old age. Cells get worn out. Right, so this is what I've done for my table. So we lose cells, you have brain kind of shrinks, brain matter kind of shrinks, and it's all got to do with tissue integrity. If you lose cells, you're going to lose tissue integrity, and then we make less neurotransmitters anyway with the neurons that we have left. All right, cardiovascular system. All right, so in the tutorials, you're going to do the two systems that are left, which are the skin, so integumentary, and we're also going to do reproductive. So I'll let you do those in the tutorials in a slightly different way, because you're probably sick of my voice at this point. I know I am sick of my own voice. Let's do cardio. Right. What happens is that your blood vessels become thicker and stiffer overall as you get older. And this is a consequence of that. So that means that your blood vessels become thick and becomes stiffer and thicker. So that means that there's less room for blood to go through it. Okay. So lumen size is reduced. So that means that you're going to end up with high blood pressure likely as you get older. So that means that your heart's going to pump harder, okay? That's just something that happens as a consequence of this increase in peripheral resistance. Your heart's going to have to pump harder to push the blood through. Now, the number of cells that make up our cardiac muscle is going to be reduced as well, so that doesn't help. And the SA node, which is the pacemaker of the heart, with those cells die. So by the time we've reached 50, we've lost nearly 3/4 of those guys. So because of this increased peripheral resistance, blood pressure is going to go up because of that. Just because of the fluid dynamics. So let's have a look at your artery, eh? So here we go. This is a younger, I don't like young and old because it's kind of rude. Younger and older is what you should say. So here is your different layers. And can you see here, these cells are doing funny things. They're going where they're not supposed to go. And so that just means that the lumen is going to be smaller. So this is a good picture. See? So you've got your blood vessels as you get older are going to become thicker and narrower. And when you're younger, you've got your cardiomyocytes, which is these are the cardiac muscle cells, happy days. But when you get older, because your heart needs to pump more or pump harder to push the blood through here, your cells are you're gonna be a bit bigger. And to add to the problem, they're going to be senescent. What does the word senescent mean? It means that those cells have decided that they are no longer going to make copies of themselves. There you go. So that is a young, can you see? And now it's going to make that area thicker. Right, let's have a look at the pacemaker. So this is this SA node. Look at the younger pacemaker. All right, don't worry about too much about these things. But look at the older ones. Yeah. So you've got all of these different changes in the tissue as you get older. And remember how I said before, pardon me, you have a low level of inflammation always niggling in the background as you get older. So there's going to be immune cells in there. Okay, so there's going to be less pacemaker cells, more fibrosis. And look at the functional consequences of that. You have less pacemaker cells, so your maximum heart rate is going to decrease. Yeah. So this is your intrinsic pacemaker here. So this is just a, and this is your resting. Okay. There you go. So your resting heart rate doesn't really change very much. It really is all about how high you can get it. So when you are younger, you can get your heart rate up a lot higher because you have, because of the integrity of the tissue than you can when you're older. That's what that means. All right. So with cardiovascular, I kind of put down that you lose cells because you do, and there's also some tissue integrity problems as well. So nothing really shrinks, not that I saw. Yeah, so that's what I thought of that. Respiratory system, last one. Right, now this is really interesting. When I was looking at this, I found it really interesting. So essentially your rib cage starts getting stiffer. Yeah, and I'm going to show you a picture of that. It's very, very interesting. As well, because you might have an issue with your spine, it makes your the volume where your lungs sit reduces it. I'm going to show you a picture of that as well. Then you also are losing muscle. Okay, so we already saw the muscle part of it. We lose the muscle cells, we lose muscle mass, and so the diaphragm and intercostals are muscles, so they're going to be affected. The ciliary escalator, I'm going to show you a picture of that. It just means that as you get older, you have less ability to clear your airway. Okay. Coughing reflex, again, becomes less sensitive. So does the gag reflex, which is something to be mindful of when you're nursing an elderly patient. And your lungs become less able to expand, okay, and they lose some of their surface area. So I'm going to show you a picture of that in a minute too. And this is about the surface area. And as I said before, in the immune system, okay, you have less white blood cells, less macrophages, but they are you have less of them, but they're more sensitive. So it's kind of odd scenario with regards to the macrophages in the lungs. It's kind of an exception. Right, some cool pictures. Check these out. This is your sternum. This is your clavicle. This is your ribs. This is supposed to be cartilage, and look what's happened. you have calcium deposits in the cartilage. Wow. And that happens over time. Yeah. So that's going to make your cartilage stiffer. You're not going to be able to open it up. Open up your thorax or your thoracic cavity as much. Look at this picture of this poor lady here. Look how curved her spine is. Look at her lungs. They're squashed in there somewhere, yes? So if that happens, your lungs are going to be squashed and you won't be able to open them up. But as you can see here, and this looks like the most painful thing ever on earth, although it looks quite cool because you can become like a Robocop, but not really. Look at that. They can actually help with the curvature by having that kind of operation, but that looks very painful. But just so you know, that can impact that, yeah? This is the mucociliary escalator. So if you breathe in a bug, this escalator will transport it just like an escalator at Westfield all the way up to here. And when it gets to here, you either swallow it, so it goes down into your stomach, or you cough it out. Okay? So this escalator slows down a lot as people get older. Okay? So that is going to, their ability to clear their airway is not going to be as good. And the last thing we need to look at is we know about the chest wall. We know about the clearance. And let's just have a look at the lungs. Look, the lungs are not going to be, they're not going to be able to come back as good as they used to. And look at what happens with the alveoli. Your alveoli get big and saggy, right? So you've gone from little grapes to big lychees. Does that make sense? Not really. So what you're doing here, when you're going from here to here, you're losing surface area. So your ability, if you lose surface area, your capacity to exchange gases is going to be reduced. Right. And I think, we're going to add that to our pattern table. And I think that overall, when you think about this, as you get older, it's inevitable, it's a fact of life that cells get worn out, cells get damaged, and cells die. And cells also stop making copies of themselves. And that results in your tissue now looking a bit different. And if your tissue changes, the function of that tissue is going to be affected. That's the take-home message for all aging. That is the take-home message. And I think if you understand that, then you're going to be well on your way, okay, to be a successful, understanding clinician. I want to congratulate everybody as you have finished all of the content in BMS 165. It has been an absolute pleasure, and I hope you do well in your studies, and I hope to see you one day in a clinical settings, working away and being the best health professional that you can be. Thanks, everyone.